and welcome again to this, your regular Thursday morning program on addiction and recovery on radio and TV Jagriti. And again, let me remind our listeners, this program will be posted on YouTube and Facebook at the end so that you can refer to it. It will also be replayed on radio and TV Jagriti at 10 p.m. tonight. For those of you who do not have the time right now, you can listen to it then. It's an interactive program, and you can call the numbers on your screen, 663-2335, 663-1027, if you have any questions or comments, and we will address them. I have been speaking about withdrawal symptoms, and it's very important that family members especially understand, because a lot of people throw their hands up in the air and express, disgust, and because they can't understand why a sensible man like their sibling or son or daughter can't stop using drugs when the danger and damage is so obvious. But they don't understand that when a person who has become dependent on a substance, whether it be illegal drugs or legal drugs that you might have taken them to the doctor and was prescribed to them, and they have become dependent on the tablets that they have. And I know a lot of parents tell them, look, you have to continue to take your tablets, and they monitor and make sure that the person continues to take the medication, because if they don't, they will become mentally ill, and which is true when you become dependent. So that there are some drugs, especially tranquilizers and barbiturates, those are sleeping pills and mood altering substances. Sometimes, if you have been taking them for years and years, you need to stop it under supervision of a medical practitioner. Because for some of them, where if you stop them suddenly, you can experience hallucinations. That is, you can see and hear things that are not there. And in the lay terms, you can appear to be crazy or mad, and of course, relatives are going to immediately read that as you're becoming mentally ill again. And a lot of professionals, and I work in psychiatry, they'll tell you, you should not allow yourself, once you've been diagnosed with a condition, you have to be very careful not to uh, renege on your medication, and so that you don't want to relapse, because every time you get ill again, it becomes more difficult to get better. And so you would hear all of these things, but I want to let you know that a lot of times taking drugs is really a dead end, because you're not going to ever get better. If you are ever going to get better, getting better, to my mind, is not have to be dependent on any medication. So that it should be every person's goal. If you have been taking any kind of medication, to seek out, speak to your doctor, speak to your psychiatrist, speak to your counselor, and work at finding ways so that you don't have to use these medication. And I'm not only talking about psychotropic drugs. There are people who are hypertensive, and once they start taking the high blood pressure pills, they have to take it more frequently and more with heavier doses as they develop tolerance for the rest of their lives. And these are lifestyle illnesses that one can, with proper diet, exercise, and supervision, they don't necessarily have to take. Diabetes is the same thing. Yes, in some case, you might have the genetic predisposition and it will be a little more difficult, but one can adjust. I have seen so many people that I know personally who have been able to come off these medications. And I myself have helped a lot of people who were dependent on psychotropic drugs for many, many years. I have helped them to come off completely using acupuncture, because the acupuncture helps to deal with the withdrawal symptoms. So I'll just go through for tranquilizers and sleeping pills. One must first check with the doctor if you're planning to stop, because some of them you may have to start cutting down the dosage and weaning yourself off it. Although I have been using acupuncture to help people to deal with the classic withdrawal symptoms, but it must be a joint effort. I would not, at the outset here, advise anyone to stop using these drugs suddenly without supervision. And the withdrawal symptoms for people who have been taking sleeping pills, and I'm specifically dealing with this one because I'm seeing a lot of people now coming. They come for bodily aches and pains and all of that, and then in taking a history, I realize they have been taking sleeping pills for years. And when you're taking these sleeping pills, you're really not sleeping, You're not getting natural sleep. It's like if I tie you down to your bed and you struggle all night to set yourself free, so that in the morning, although you can't remember what happened last night and you interpret that to mean that you were sleeping, but the next day you're not feeling well. You're feeling like, your whole body is like you were in an accident or something. Your eyes are dry, mouth. So let me just read some of these withdrawal symptoms of sleeping pills. And of course, if you're taking it for insomnia, the withdrawal symptom, the first one is insomnia, because now you have become dependent on the pills, and if you stop taking it, you won't be able to sleep. And some of the withdrawal symptoms also include anxiety, panic attacks, muscle pain. So your muscle pain may not be because you strained something, or you generalized body aches and so on. It could very well be as a result of your withdrawal symptoms from your sleeping pills. And then you can suffer with depression and seeing and hearing things that are not there. As I said, if you stop it suddenly without help, you can have dizziness, you can have abnormal sensitivity to noise, touch, and smell. You can have a feeling of weakness, and a lot of people complain of heart palpitations. It's like you're scared when you're coming off these things and your heart keep racing. The mouth is dry in some people, and some people have a feeling of having an enlarged tongue or a metallic taste in their mouth. There's also the sensation that you have a tightening band around your head. So these are symptoms that can be pretty strange. Some of the symptoms seem to be minor ones, but they are nevertheless very strange. And some people have a metallic taste in their mouth, as I've said, or experience the feeling that buildings are going to fall on them, or that the ground under their feet is not solid. Muscles may twitch uncontrollably. Now, if this sounds a horrifying list of symptoms, the authors say, take heart. Most people only suffer from 3 or 4 of them. The problem is that the withdrawal symptoms can confuse you into thinking that the old anxiety for which you were originally prescribed the pills is back again. And the authors are saying it isn't. Though the symptoms can last for several weeks, even months, if you have been taking the tablets for years and years, all the anxiety and confusion of withdrawal will settle down eventually. And their advice is to, of course, go to Narcotics Anonymous or Alcoholics Anonymous meetings and find somebody who has been through the same experience. That way you will get the understanding you need. Be careful not to substitute drink or any other drug for tranquilizers. Now, I thought that was very important that you hear it, like we say, from the horse's mouth. But I have been seeing a lot of people, and what happens is a lot of people use sleep as a way of escape. I wanted to point that out because this is why a lot of people who are going through stressful situations in their life, who are not very happy about the way things are, they find that the only time they get a reprieve from all of these, painful thoughts and stressful memories and so on, is when they are asleep. And this is why a lot of people attempted to take sleeping pills. And the problem is perpetuated because if this situation, their life situation, does not improve, they are likely to become dependent and continue to use these sleeping pills. And after a short while, you'd find that your body starting to develop tolerance, because that's the natural way the body operates. Anything you put in your body that is harmful, that the body sense is not natural, the body's normal natural reaction is to try to immobilize it, to neutralize it. So that, let's go back to an example. Anyone listening out there, when you took your first beer for the first time, boy, I remember when I drank my first beer, I felt a buzz. I felt a little bit dizzy, you know, and I felt kind of euphoric because my body had not been used to alcohol. And so it was, to my mind, enjoyable. And I never forgot that. You know, it became an indelible thing in my memory. But in a little while, later on, when I would start drinking a little more frequently, beers, one beer did nothing to change my mood. I had to drink two beers and then three beers. And then after a little while, I find I was drinking too much beers and still not getting to that place that I would like to get, you know, that high. And of course, it didn't take too much mathematics to realize because once you start drinking beer in a bar, somebody at some point is going to introduce you to harder stuff like rum, and then you go to red rum, and then you go to white rum, and then you go to stronger, which all of that is the evidence that the body is developing tolerance, that the original dosages are not working. And just like in physics, the higher you go, the harder you will fall. So too, the more psychotropic drugs, whether it's sleeping pills, you use the higher doses you go to, whether it is tranquilizers or sleeping pills, as I said, or alcohol or any other psychotropic drug, when you're coming off, the withdrawal is going to be more severe. So for alcohol, you know, you can at first, you have the nausea and the vomiting, and then you have the feelings of remorse the next day, a little bit of anxiety and palpitation and hot and cold flushes. All of those are classic withdrawal symptoms for alcohol. But then as you continue to take higher doses, you'll find you'll reach to a point where you can't remember what is happening. Well, that is one of the withdrawal. Hands will start shaking. You'll start feel like things crawling on your skin. It's called tactile hallucination. And then you start hallucinating and seeing things that are not there. And people around you are going to begin to think, in our culture, you know, that maybe you are possessed by some spirit or some demon. And unfortunately, they'll probably take you to the pandit or the priest or the obeahman, because the first, you can't, you know, a lot of people who do not understand that this is one of your withdrawal symptoms because you were drinking a day or two before, that you are seeing and hearing things, and they will, of course, the obeahman and them will come up with a theory. They're very good at that, you know, to tell you, well, look, the neighbor might have put something in your yard, throw something in your yard. And, you know, we Trinidadians, we have a, a tendency to believe these things, especially if we were not doing well with the neighbors or if things were not going too well with us. You know, we immediately build stories around this, and we don't go and seek professional help as we should. And even so, when you go to the professional, if you went to a psychiatrist, you'll get, of course, he'll probably switch the brand of medication and put you on something that he thinks is appropriate. But you cannot use drugs to treat drug addiction. And I make that very strong statement, having worked in the field of substance abuse for years with a lot of psychiatrists who were my good friends. But the truth is, yes, you could use drugs to help a person during the detox period, to wean them off the drug that they had become dependent on. But beyond that, if you continue to use a drug, you'll just go full circle again. It's like you're back on the merry-go-round, where The drug is putting you to sleep, and next day, if you don't take it, you start suffering with withdrawal symptoms. And for this reason, I introduced the use of acupuncture in treating drug addiction, because you cannot become addicted or dependent on acupuncture. There's 5 little needles that are put on the ears. It's not painful, but it helps to deal with all the withdrawal symptoms. Every week, in fact, this week I treated quite a number of people who were having insomnia as a result of their drug addiction, alcohol. Would find that they can't sleep if they don't drink, they can't sleep. And I've been able to take using acupuncture to help these people come off the alcohol and stay sober by having a treatment, coming for counseling, and going to the AA meetings. And I know some of them are listening to this program as we speak. So that it is simple, but it is not easy. You have to want to do this. And it is important for the people around you to surround yourself with people who understand the nature of what you're going through. And that's one of the main reasons that a lot of people find it is very useful to go to Narcotics Anonymous or Alcoholics Anonymous meetings, because there you are definitely going to find people who were worse off than you a lot of times. They were worse off than you, and they were able to stop using it, and they can share with you very, very valuable insights into how to deal with these withdrawal symptoms. Because yes, the physical withdrawal symptoms of alcohol, the shakes and the insomnia and the remorse and all of those things, the hallucinations and so on, will quiet down in a few days. But the psychological withdrawal symptoms can last a very long time, a lifetime, because a lot of people not only depended on the drugs, and the psychological withdrawal symptoms also holds true for the illicit drugs as well. While there may not be too many physical withdrawal symptoms from cocaine and marijuana and the amphetamines and so on, the stimulants, there are psychological withdrawal symptoms, because a lot of people, when they should have been learning to face and deal with their life problems, were seeking to escape by using these psychotropic drugs, the illicit drugs or the alcohol. And now that they have stopped, they have to be able to deal with these on a sober head. And for some of them, this is a very daunting task. It is scary sometimes, because we have become habituated, I could remember if I had to make a speech in the old days, I would have to go and take a few drinks, to bolster my courage. Or if I had a heavy session or something, stressful situation to deal with, I would want to take a few drinks to unwind. And so there's a lot of people out there who have become psychologically dependent, to just go to a fete and have a good time. They have to drink, because if they're on a sober head, they can't ask the girl to dance, or they can't even dance. They become very self-conscious. I have had all those experiences, so that the alcohol and the drugs become interwoven in their lifestyle, and not only in their personal lifestyle, but in their social lifestyle as well, because now they would like to stop, but all their friends are people who drink. And I'm thinking of a few people that I know, people I know very closely, who I know they are come to realize, well, look, this drinking is not good, boy, this thing causing, even health conditions for me. But then I don't have any sober friends. And the activity I engage in every day, includes meeting with people who are, taking a drink and that kind of thing. And they can't understand, they can't even imagine how they'll be able to stay sober. Immediately it occurs to them they'll have to give up all the activities that they engage in, all the friends that they currently have. And very few people can imagine doing that, because they've never stayed sober before. It seems very, very scary. And this is why counseling is important. Going to AA meetings is very important, because you will fill that void of loneliness by finding friends and people who understand your condition and who can give you that support. Because they even the person who, as I say this, over time, anyone who is drinking out there would realize that the sorry about that. Yeah. Um, anyone would realize that, by drinking progressively, you're surrounded by people who drink and use. And I speaking from personal experience there, because if you're not drinking, I'm in with you. And over time, where before drinking became prominent in my life, I would go to PTA meetings, I'll go to Bhagwat and all those other kinds of activities, social activities and so on, play sports. But after a little while of drinking, and when drug really take hold of your life, you're only going to River Line, you're only going to fete matches, you're not going to PTA meeting anymore. You understand? You're not liming with people who are not drinking. If we're going by the river and you're not drinking, we're not picking you up. So without realizing it, your whole lifestyle, your social life becomes interwoven with alcohol. And so that withdrawal is not only from the physical effects of the alcohol, the drug that you're taking, but withdrawal will also include the social and psychological effects of stopping drinking, where you'd have to now change your lifestyle, alter your attitudes, so that this is why, although it is challenging, it is not impossible. So that anyone who really has a desire, once you look at the role that alcohol is playing in your life, yes, when you stop, and many of them, when they stopped in the past on their own, would have gone through the withdrawal symptoms that I described this morning and relapsed. And every time you relapse, you lose confidence to the point where I had reached to that place as well, where I decided, look, I will have to drink until I die, because I couldn't see a way that I could stop. And it is not for failing to try. I had tried so many times. When I promised other people, I would try to keep my promise. And then I stopped promising people that I'll stop, but I would promise myself. And then I would fail again. And after failing so many times, I stopped trying to stop. I started to rationalize and make excuses so I could continue. And I've shared that many times on this program. I would say to myself, I'm not playing cricket, I'm not playing football, I don't gamble. So if I take a few drinks, what's wrong with that? And I wasn't up to that time really getting into too much serious problems, with alcohol. And as a result, my drink, it perpetuated, my situation caused me to continue to drink. So I want to let our brothers and sisters listening out there know that, look, those of us who have worked in this field, who are in recovery especially, we know what you're going through. We can identify the people in AA and in Narcotics Anonymous. They understand what you're going through, and this is why they are so successful in helping others worldwide. You'd find that Alcoholics Anonymous is now in over 189 countries in the world. It is one of the most successful programs when it comes to helping alcoholics, and now drug addicts too, who have been addicted to cocaine and marijuana and heroin and methadone and all ecstasy and all those other drugs, are now going to Narcotics Anonymous and using the same formula to help themselves to come off those drugs as well. In fact, not only drugs, this program that is used, the 12-step program that you heard at the beginning of this program, also help people with behavioral problems, like people who have become addicted to food, who have become addicted to gambling, people who have become addicted to relationships that are causing them problems. So the same steps, the same 12 steps, and the group support that is found in these various anonymous groups have been found to be very, very successful. And I have been referring my patients to these groups for years now. I have been in the field of recovery for pretty near 40 years now. And I've been sending my patients, to Alcoholics Anonymous, to Narcotics Anonymous, and now we have meetings that are online. Only this week I referred quite a few people to the online meeting. There are meetings every night in Trinidad and Tobago and worldwide. And anyone who would like to attend a meeting, these are open meetings. If you're curious and would like to know what an AA meeting is like, what happens at an AA meeting, they allow visitors as well. You can come in and say, well, who you are. Even students who are writing papers on substance abuse and so on from the university, they are welcome to attend. Professionals are also welcome to attend. So that I see we have a caller. Hello? Hello? All right, seem like we have lost that caller. All right, so we're coming up to the end of the program at this point. I would like to wrap up at this stage and let you know that this program is going to be repeated tonight at 10 p.m. on Radio and TV Jagriti. And we will see you again next week, Thursday. Remember, it is posted on YouTube and Facebook at the end. And if you have questions, of course, you can call me at 671-3040. And I'll be only too happy to respond to your queries and your questions. So thank you for joining us this morning again, and see you next week, Thursday. Bye for now.